Mr. and Mrs. Mann.
Hello.
Hi. Oh, so sorry to startle you. My name is Sandy. I'm going to be your nurse for today. How are you doing?
¿Está bien?
Está bien. Great. ¿Habla inglés?
Sí.
Okay.
Yes.
Okay. Are you comfortable speaking in English?
Yes.
Great. Okay. So I'm just going to do an assessment on you. I understand it is your second day of your hip surgery, and I just wanted to take your blood pressure and check your wound and see how everything's looking, okay?
Okay.
Great. Okay, if you don't mind, I'm just going to lift up this here. Great. Oh, okay. It looks like it's a little bit saturated. Mr. Mann, do you know if this looked like this yesterday or a couple hours ago?
It wasn't that bad.
It wasn't that bad? Okay, so here's what we're going to do. I'm going to actually notify the doctor and have him check out this wound and see if we can get orders to clean this out, okay? All right. So how's your pain? On 1 to 10?
8.
8? Okay, can you describe it to me? Is it a sharp, dull, throbbing?
Sharp? Like sharp?
Sharp, okay. Sharp? Okay, great. All right, great. We'll get this subject.
Ativan.
Oh, we'll check.
Hello. Hi, good morning. My name is Carla. I'm one of the case managers at the hospital here. Are you Mrs. Joanna Mann? Yeah, hello. Hi, so I just came to discuss, I'm glad you're here too, because I just noticed we have discharge orders for you for today from Dr. Smith. So I just wanted to discuss a little bit about going home today and getting you ready for discharge.
Isn't it a little bit early though? She's
Too fast.
Yeah. Also, actually, his blood pressure is very elevated. His norm is usually, her norm is normally 110 to 60.
60 over 88? Okay, I mean, well, we can discuss a little bit about the other options that we have, because you guys can go home with home health and you can get nursing at home and everything like that.
Okay, well,
So-
like, I mean, look at his wound here. Her
Yeah.
wound is, like, very saturated, and she's complaining of increased pain. And, I mean, do you really think this is...
and is she gonna be okay at home by herself? Because I'm at work most of the time and I actually have to work soon. So
Okay, well, you know what? We can definitely discuss that with our health supervisors. So I will be right back, okay?
okay.
Hi, my name is Beatrice Felix, and I'm the house supervisor, and I called in this meeting to discuss the pros and the cons regarding early discharging.
So according to the journal, American Journal of Nursing, there's the hospital care at home is a concept that was introduced 20 years ago, and it provides acute level hospital quality care in the home as an alternative measure to hospital admissions. It also decreases the hospitalization for older adults. It prevents falls. They decline, functional decline in hospital-acquired infections, and it reduces mortality and cost for the hospitals.
According to the Joint Commission, more than 2.5 million patients in the United States in acute care facilities are estimated to suffer from pressure ulcers and injuries, and more than 60,000 die from their complications each year.
According to the European Journal of Health Economics, their findings indicate that patients with longer hospitalization time are less likely to be readmitted within 30 or 90 days after the initial discharge. For an example, an additional day in the hospital reduces the probability of readmission rates within 30 days.
One of the most critical factors that may be affected by decreased length of stay is the quality of care that is received by patients. According to a study, Renee Mardy and Kenneth Brownson sought out to find if this was directly affecting the quality of care that patients were receiving. During the interview process, they encountered interesting personal accounts from clinicians. An occupational therapist was asked to give her testimonial on how this practice has affected her role, and she responded by saying, "It was difficult to recommend a discharge plan for patients who are acutely ill. Decreased length of stay affects the ability of staff to deliver care to the best of their potential, as evidenced by the testimonial."
Hi. So because we are a patient-driven healthcare system, we believe that you have the right to make your own decision. Okay, so would you like to go home?
No. No. Kindred Hospital.
No, we're going home.
Kaiser Home Health.
Yes, we do have Kaiser Home Health for you.
I hear great things.